We're all trying to make a diagnosis of Parkinson's disease better. This is a clinical rating scale, but it's never been conclusively validated pathologically for each individual item. The 2015 MDS criteria were developed using expert consensus. They didn't actually use pathologically confirmed definitions. So it's really important, I think, that we know that each of these criteria, supported criteria, absolute exclusion criteria, red flags, really are supported by the pathology. So any of these, if you look at a patient with Parkinson's pathologically, do these actually hold up? So I think this was the time to do it. What we're trying to do really is see, is there any way of making the currently published MDS 2015 criteria any better for the practicing clinician or for the research? We ended up with a large cohort, 28 articles, and these included a cumulative total of over 1,500 Parkinson's disease pathologically confirmed and over 1,200 pathologically confirmed atypical Parkinson's. And then we went through each of these articles as a committee and looked at each of these criteria in detail and determined, could we, from the article, really determine in which cases was there a clear and dramatic response to dopaminergic therapy, for example. And so you can see in the results here, each of the criteria are listed. There's a column there for Parkinson's, and then for each of the atypical groups that we looked at. And we've just highlighted here some of perhaps the more interesting findings. The one that is helpful is a normal neuroimaging of the presynaptic dopaminergic system, so a normal PET. If you've got a normal PET, then you don't have Parkinson's disease. The whole idea really here is to take the currently, I would hope we could say, gold standard way of diagnosing Parkinson's disease using clinical criteria. Can it be better refined? Are there things here that are redundant? And then yes, ultimately, as biomarkers become validated, then they will be added into this type of rating scale to improve specificity and sensitivity.